Hi, everyone. Thanks for joining us. I'm Jonathan Modi with OHA External Relations. I'm joined by Dr. Dean Sidelinger, Health Officer and State Epidemiologist, who will give our monthly update on COVID-19 and the other circulating respiratory viruses in Oregon. Just a friendly reminder to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. Please make sure to include your media affiliation so we know you are with the media. Unfortunately, if you don't include your media affiliation, we can't let you in, and you'd have to join the YouTube stream. And if you're not with the media and you got in, we just ask that you please head over to the YouTube live stream we included with the advisory for this media briefing. As Britt mentioned, if you would like recording privileges, just send him a note in the chat here and he'll add you. And by the way, if you do have audio issues, I know we did last week's press conference, and you're not able to ask a question, feel free to just drop it in the chat and I'll ask it on your behalf. Also, for our ASL partners on this call, I ask that our media partners please speak slowly. One last bit of housekeeping, a reminder that a recording of this briefing will be available at the YouTube link we shared in announcing this event. So that live stream link will become the recording effectively. If you need that link again, please send me an email, phd.communications@oha.oregon.gov, and I'll send it to you. And with that, I will let Dr. Sidelinger kick it off.
Thank you, Jonathan, and thank you all for being here. Good morning. I'm Dr. Dean Sidelinger, Health Officer and State Epidemiologist with the Oregon Health Authority. Thank you for joining us. As we prepare to move into spring in the next couple of weeks, my sense of optimism is growing. We have made it through the worst respiratory virus surge this state has ever seen, and conditions with COVID-19, RSV, and influenza are better overall than they've been in a long time. Such optimism was not always easy to muster in the more than 3 years since we announced Oregon's first COVID-19 case on Friday, February 28, 2020. I remember that day well. The daily reports of hundreds of COVID-19 cases and deaths and the suffering and loss we knew each one brought. The worry about the devastation that the next holiday or variant-driven surge would trigger, the shortages of vaccines and treatments, and the misinformation about their safety and effectiveness. The outbreaks that may have been prevented with masks, physical distancing, and getting vaccinated. The Oregonians from vulnerable communities that suffered the greatest from the ravaging effects of the virus. To those who have experienced and continue to face the challenges of a COVID-19 infection, battled long-term symptoms, cared for ill family members, or are mourning the loss of a loved one, I know you have suffered, and I share in your worry, your grief, and your sorrow. Today, I'm here to report that the near-term outlook for our state in the battle against COVID-19 and other respiratory pathogens is good. People in Oregon continue to get COVID-19 vaccines, with nearly 87% of adults 18 and older having received at least one dose, 78% completing a primary vaccination series, and more than 25% receiving a bivalent booster shot. Test positivity for respiratory viruses is trending downward, with rates for influenza and RSV now consistently below the thresholds at which we would consider circulation to be a growing concern. And although hospitalizations for respiratory infections in Oregon have stubbornly remained above 200 per day, with a brief increase in the last month driven by a rise in COVID-19 activity, they too are declining overall. Even with recent increases in community transmission of COVID-19, we are not seeing a subsequent increase in hospitalizations. In fact, we saw numbers under the Oregon Health and Science University modeling team's February 15th forecast, which predicted a peak of 283 people with COVID-19 in Oregon hospitals last Friday, March 3rd. On March 1st, COVID-19 hospitalizations were at 232, and yesterday they were at 229. But we need to remember that these numbers represent people with families, our neighbors. Too many people continue to get sick. If you haven't yet had your bivalent COVID booster, get it. If you haven't had your seasonal influenza shot, it's not too late. I feel confident that by next month, our state's hospitalization rates for respiratory diseases will return to lower levels in Oregon hospitals. As a reflection of these positive developments, we have seen a number of significant changes in our state's response to the COVID-19 pandemic and the respiratory virus surge in recent weeks. Last week, we announced that we are lifting Oregon's mask requirement for healthcare settings effective April 3rd. These settings include any place where healthcare, physical, dental, or behavioral healthcare is delivered, such as hospitals, long-term care facilities, mobile clinics, ambulances, outpatient facilities, dental offices, urgent care centers, counseling offices, school-based health centers, complementary and alternative medicine locations. As we shared Friday, this is a positive step in our ongoing response to COVID-19. Indicators of COVID-19, RSV, and influenza spread have significantly decreased in the last several months and continue to decline. As of yesterday, COVID-19 test positivity is at 9.6%. Influenza test positivity is at 0.3%, and we have met criteria for the end of the RSV season. These significant reductions in respiratory virus activity have meant less pressure on our healthcare system, although we still see high demand for hospital beds already running at or near capacity statewide, which shows COVID-19 continues to be with us. But we are headed in the right direction. While we are confident that lifting the statewide mask requirement for healthcare settings is the right thing to do, we recognize this action is cause for anxiety for some people, especially for those with chronic conditions or who are immunocompromised, who are at higher risk of severe illness from a respiratory infection. People have a reasonable expectation that the places where they seek medical care are going to be safe. I believe these places are safer now than they ever were earlier in the pandemic or last fall's respiratory surge. But high-risk persons can and should take additional steps to protect themselves and reduce the risk by wearing a mask in these and other indoor settings and by staying up to date with recommended vaccines and boosters. Some healthcare settings may continue requiring masks at their sites, either based on their own policies or federal rules. OHA supports these partners in making those decisions based on local conditions. Check with your local healthcare provider to find out if you may still need to wear a mask during your next visit. Supporting the need to end the mask requirement for healthcare settings, and another criterion for lifting the healthcare mask requirement is that Executive Order 22-24, which former Governor Kate Brown issued December 7th, 2022, expired this past Monday on March 6th. The emergency declaration gave hospitals needed flexibility to respond to a surge in COVID-19, RSV, and influenza hospitalizations that pushed many emergency departments and critical care units to the brink last fall. The surge caused many hospitals around the state for the first time to implement crisis standards of care so that they could more efficiently adjust staffing and bed use to provide the best care to as many critically ill people as possible. While this was a very difficult time for our healthcare partners, it allowed for unprecedented coordination amongst Oregon hospitals and state and local agencies. OHA also brought additional healthcare providers from out of state to help ease the state's hospital capacity issues, and it was able to pursue $25 million in additional state funding for supplemental nurse staffing contracts to address the critical workforce shortages. We're relieved to have gotten through this very challenging period, but grateful to have had the opportunity to support our healthcare partners in ensuring continuity of care for their sickest patients. As I shared earlier, it's important that people with chronic conditions or who are immunocompromised consider taking steps to protect themselves as the mask requirement for healthcare settings ends. This also pertains to caregivers and household members of people with these conditions. As we move forward in living with COVID-19, in which we manage the constant but low-level presence of the virus in our communities, we need to shift from a state-level response to a focus on individual risk assessment. We now have access to tools we did not have at the start of the pandemic: safe and effective vaccines, antiviral medications for preventing severe illness, information on how the virus affects people with certain medical conditions, and resources for understanding the level of transmission in communities. I want to repeat what I shared at February's media briefing, which is OHA and CDC guidance that empowers individuals at risk for severe illness to prepare for COVID-19 exposure and possible infection with these simple recommendations. Number one, know your risk. Talk to your healthcare provider about whether your age, vaccination status, or medical condition makes you more susceptible to severe illness. Number two, make a plan. Think about how you'll protect yourself and those around you if you become ill with COVID-19 or your community's transmission level changes. And number three, take action when needed. Get tested if you have symptoms. If you test positive, contact your healthcare provider for treatment or consider telehealth options. Let those around you know they may have been exposed. Isolate at home at least 5 days. Wear a high-quality mask at least 10 days and monitor your symptoms. Finally, I wanted to share that our monthly COVID-19 briefing in April will be our last regularly scheduled briefing. We will remain flexible as we have throughout the pandemic and ready to restart these briefings as conditions with COVID-19 and other respiratory viruses dictate. I appreciate the incredible commitment of all of you to keep the attention on COVID-19, influenza, and RSV throughout the pandemic and during these recent surges. You are all part of the state's public health response during these crises, and I want to thank you all for your dedication to quickly and accurately deliver critical, life-saving information to people in Oregon so that they could take steps to keep themselves, their loved ones, and their neighbors safe and healthy. As Oregon's healthcare system prepares for the end of the state's mask requirement, I want to ask everyone in Oregon to show support, acceptance, and kindness for workers, patients, and visitors in healthcare settings, regardless of whether they require masking or choose to wear a mask in these settings. The same goes for anyone in any indoor or outdoor public place. Wearing a mask offers significant protection and should never be stigmatized. With that, I'm happy to take your questions.
Thank you, Dr. Sidelinger. Just a reminder to please use your raise your hand function if you'd like to be added to the queue. And please make sure to please mute your audio. And I think someone does not have their audio muted. So if you could please mute your audio now. And again, please use your raise your hand function to ask a question. Also, just a reminder to reporters on the call to please speak slowly for our ASL partners on this call. And the first question goes to Gary Warner with EO Media. Go ahead, Gary.
Yes, good afternoon. Can you hear me there, Jonathan?
Yes.
We can hear you.
Okay, great. And thank you, Dean, for doing this again, as always. One of the things I wanted to underline is that the new masking rule is not a ban on masks in medical and healthcare situations. That will be an individual decision by both the centers and by the care providers. Have you heard back from any hospitals or major care facilities that they will continue the masking? And should people be ready to deal with places where they're going to go in there and see a sign saying, we are continuing to mask?
Thank you, Gary. Let me reiterate. We are lifting the requirement to individuals. So staff, patients, and visitors in healthcare settings wear a mask. Individuals may choose to continue to wear a mask in these settings as they can in any other settings throughout Oregon. Individual provider or location may continue to require masks be worn by their staff, their patients, and visitors to those settings as well. We are hearing through discussions that many systems and providers are considering keeping a mask requirement after April 3rd, particularly in some locations where some of the highest risk individuals often seek care. This may include things like bone marrow transplant units or chemotherapy clinics or places where people are seeking care for cancer and are often immunocompromised. I don't have a count of who is doing it and who may decide to do that, but we know those discussions are ongoing, and this lead time to April 3rd is appreciated by those partners and by our patients and consumers. But even with a month lead time, many are still nervous about what this may mean. And so that's why I ask that we all support each other's decisions going forward to continue wearing masks, as this does offer significant protection and again, should never be stigmatized.
Okay, Dean, I'll let you go on that right now. Thanks.
Thank you, Gary. Next question is from Christian Fodenvenzel with OPB. Go ahead, Christian.
Hey, Gary. I just wanted to ask, the mask mandate as it's being lifted in healthcare settings, what's your advice to employers about wearing masks in offices? Because here at OPB, for example, we have an open newsroom. You don't have to wear a mask. But if you go to the kitchen or you go to a corridor or into some of the recording studios, we are being asked to wear masks. I think there's a lot of confusion and people don't know what to do. What are you telling employers to do?
I think employers need to assess the situation, talk to their workers, talk to their staff, and make a decision that makes the best sense for their location. We know that when we're in shared airspaces with other individuals, if an individual is sick with COVID-19 or influenza or RSV, they can transmit it to others. And so certainly wearing a mask in those settings can help provide some protection. And if everyone's wearing a mask, that can provide an even greater level of protection. Our three commonly circulating respiratory viruses, COVID-19, RSV, and influenza, are circulating at lower levels right now. So there's less risk in those settings. But what I would ask employers to do is to reinforce with their staff that if they're feeling sick or have symptoms consistent with these viruses, that those individuals should stay home and not come to work. Hopefully, employers have paid leave policies that can support individuals in making that choice, or if they need to stay home to care for a sick loved one, such as a child or older adult. And keeping sick individuals out of the workplace can also help limit the spread of disease. And any messages that they can give as an employer or through their health insurers about encouraging people to get vaccinated, being up to date with COVID-19 boosters and their influenza shot will also help. But those masking kind of rules, or everyone masking in an individual work site, should really be made as a collective by the individuals and the staff, at those work site, depending on how people feel.
Thanks.
Thank you, Christian. Just a reminder to please, if you want to ask a question, use the raise your hand function, or feel free to drop a question in the chat and I can ask on your behalf. We do have a follow-up question from Gary Warner with EO Media. Go ahead, Gary.
Yeah, actually, this is, I was going to say this till the end, but I'll throw it out there now. You've been monitoring the avian flu situation. Last time you said you don't see it as a major human problem at this point. Anything changed since last talked on that?
Thanks, Gary. Avian influenza, or a flu virus that affects some of our that affects birds, both wild birds as well as chickens and other birds that are being raised for food, has been a huge concern here in this country, with many birds being culled because of avian influenza positivity. We have yet to see significant spillover into the human population. So we have seen some avian influenza viruses in other mammal species. We will continue to work, public health colleagues and our agriculture colleagues, hand in hand to follow this virus and to see if there's a strain that may spill over that could cause more disease in humans. But at this time, we're not seeing a significant risk to transmission in humans, but we'll continue to monitor it, and we'll come to you with that information when we get it.
Thank you.
Thanks, Gary. I don't see any hands raised and no questions in the chat. We'll just give it a few seconds here to see if anyone has any other questions. And we can get to your question.
Hey, Jonathan, it's Gary again. I guess I got one more follow-up if nobody else has a question, which is how does OHA feel about its stockpiles of gear, of vaccine, of tests going into the summer? You know, when this thing started, of course, that was a major issue. Also, there's been some concern that the Biden administration may drop its asks for funds for COVID-19 because of Republican opposition. And is that going to undercut the state's ability to be prepared if there is some sort of resurgence?
Thanks. Let me start with our current supply of measures to combat COVID-19. We are in a much better place with personal protective equipment, including masks and gloves and gowns, to meet another surge of respiratory virus, whether it's COVID-19 or something else. We still have supplies of federally purchased vaccines and antiviral medication that will carry us through into the summer and maybe beyond, depending on the need. And with our vaccines, with the end of the state of emergency and then subsequently a change to commercialization, we still know that those vaccines and their administration will be covered by insurers. There may be a more narrow network or locations where you can get those vaccines, but they will still be covered at no charge to those with insurance. And our community health centers, local public health, and other community partners will continue to offer vaccines to those who are uninsured, so at a much smaller level than we've been doing now. So I feel good about our current supplies to combat COVID-19 and other respiratory illnesses that are in front of us. What this pandemic has demonstrated time and time again, though, is that the public health system needs investment to continue to combat what's in front of us and what could potentially be in front of us. The public health workforce has shrunk in recent decades and was at low levels when we started this pandemic. We appreciate, the resources that were invested at the federal, state, and even at some local levels into our public health response. We know that our public health workers stepped up and combated the virus, combated stigma, provided education, vaccines, and medication in their communities, and that continues to happen. We know that the level of response will change significantly this summer as federal resources tied to the state of emergency and FEMA reimbursement come to an end. But we hope that ongoing funding will be secured so the public health system, my fellow colleagues, can remain strong, prepared to continue combating this virus, as well as any other emergencies that will come our way, because we know they'll come our way, whether it's an infectious disease, an environmental release, such as that in East Palatine, Ohio, effects of climate change and the impacts on increasing wildfires, effects on water quality. Public health is there to respond and help keep you safe, but we can only do that with appropriate investment.
Just to follow up real quick, Dean, this will be my last thing. Those of us who remember, I think it was June, right before Delta, there was almost we came very close to a mission accomplished attitude on COVID, and it came roaring back into its worst two periods. While the Omicron variant and subvariants seem to be in this rut of basically recreating highly contagious, but on individual case, not as virulent versions. It seems like everybody's throwing in the towel. I'll be honest with you. You know, you've got Johns Hopkins is shutting down its coronavirus center. We're getting fewer briefings, less information, and there's for folks out there who are worried that we could see a resurgence and that information and resources are not going to get out there. What do you have to say to them? I mean, it doesn't have to be Omicron. There could be something down the line.
Well, I can't say that there will be no future resurgences of COVID-19 or other viruses. I do know that public health will stand prepared to do that. And while our routine briefings may be slowing down and the amount of data that is put out has changed, we are committed to putting out regular updated data that can help monitor the spread. We know that as more people test at home or don't test at all, that numbers of people who test positive for COVID-19 reported to public health don't mean the same thing they did earlier in the pandemic. So we are adapting our current surveillance system for diseases like influenza and RSV, which are not reportable to public health, but where we work with laboratories and providers across the state to voluntarily report in the number of tests they do and the number that are positive and positive for which type of flu to us to monitor the spread of influenza. We can adapt that same system to COVID-19, and those providers are voluntarily providing that information. We have wastewater detection still going in many communities across Oregon. While that doesn't provide a real-time answer, it does provide an indicator of where we are with the spread of COVID-19. We will continue to sequence a subset of our positive tests here in Oregon, as other states do, to monitor for emergence of new variants, whether they come from right here in Oregon or are entering the state from other states or countries, and we will continue to do that. So we will have some ongoing sustainable systems to monitor disease, and we will come to you, the media, and come to the general public if we're seeing alarming trends or people need to change their behavior. So I think, you know, the amount of information may be going down, but we're honing that information on quality information that can be sustainable and monitor this disease over the long term so that we can provide the appropriate messaging to people. We will continue to support our healthcare providers as vaccines become commercialized to ensure that those who need vaccines have access to vaccines. We will continue to play a part in making sure that access to antiviral treatments is ready and that people are ready to access those treatments by having a plan. And we'll continue to provide fact-based information on our website about vaccines and their effectiveness, the effectiveness of masks, and other things that individuals can do to protect themselves to try and combat some of the misinformation and frankly, disinformation that is spread online. So you have my word on that OHA will continue to be in this space with our local and tribal public health partners from across Oregon, and our federal partners are there in support of us as well.
And you're staying, Dean, with OHA. I mean, there's been a little bit of a shuffle at the top, you know, since Governor Kotek came in.
As far as I know, I have not received any indication that I will be leaving. And even though after 3+ years of combating COVID-19, I am a little exhausted, I am happy to be in this position, supporting an amazing public health team across OHA, our local public health partners, and tribal partners to combat this disease. And I know that we have many other issues facing Oregonians, from the scourge of fentanyl and other drugs, to climate change, to other infectious diseases like Mpox that we need to continue to combat, not to mention vaping, nicotine addiction, and chronic diseases. That I'm happy to continually be challenged in this position and to show up and support my team in making Oregon a healthier place and to reduce inequities over the next 10 years.
Well, thank you for all your work, and that's it from me.
Okay, thanks, Gary.
Thank you, Gary. Appreciate it. Before I ask Dr. Sidelinger to close it out, since we don't appear to have any other questions in the queue, just a reminder to look for the the recording on YouTube at the YouTube link that we sent out this morning for the live stream. That again will become the recording, and also a press release will be going out this afternoon summarizing this briefing, and Dr. Sidlinger's script for this briefing also will be posted on our website. So with that, Dr. Sidlinger, do you have any closing remarks?
Thank you, Jonathan. I want to thank all Oregonians who've stepped up and been vaccinated and boosted against COVID-19, gotten their influenza shots, worn masks when disease rates are high, worn masks to protect themselves and their loved ones because they're at higher risk. You have made a difference and you continue to make a difference. 9,400 Oregonians almost have died from COVID-19, and I know that's 9,400 families, friends, and neighbors who are mourning the loss of those individuals, and that we still see people getting sick with COVID-19, people needing to take care of relatives, loved ones with COVID-19, and people suffering the effects of long COVID. So COVID has not gone away, but we need to face these coming weeks and months with optimism. Disease rates are going down. We have effective tools to help prevent this virus and to treat this virus and prevent serious complications. We know that the weather is going to get sunnier. We're going to move outside and enjoy the incredible Oregon summer. And that's a safer place for us to gather with friends and loved ones so that we can get back to a more normal life. But we are going to have to live with COVID-19. Some of us, whether we have underlying conditions ourselves or care for someone who's at higher risk for COVID-19, will continue to take more precautions. And I know that Oregonians will step up to support each other in those decisions. I know that as we face changes in the federal response with the state of emergency ending, with COVID masking rules and healthcare settings changes, that can increase anxiety in some individuals, but know that these decisions are not taken lightly. And all indicators are that even with these changes, we can face this virus together and prevent more serious disease. So thank you for your continued effort. I look forward to keeping you updated on this situation.
Thanks, Dr. Sidelinger. Thanks, everyone. Have a great rest of your day.